हाँ,
Okay, sir. Let's start.
ओके। सबसे पहले हम भगवान धन्वंतरी को नमन करके हमारे इस 6 मंथ मास्टर क्लास इन आयुर्वेद ऑर्थोपेडिक को शुरू करते हैं। सभी को नमस्ते। हम आज एक नए जर्नी को शुरुआत करने वाले हैं। सभी का इस कोर्स में मैं स्वागत करता हूँ। आईआईएस का इस कोर्स आयुर्प्रभा और आईआईएस का इस कोर्स को डिजाइन करने का एक मेन उद्देश्य यह था कि आयुर्वेद ऑर्थोपेडिक सुपर स्पेशलिटी प्रैक्टिशनर की एक कम्युनिटी बने। जस्ट सर ने ऑर्थोपेडिक प्रैक्टिस सेट करने के लिए लगभग 7 से 10 साल का समय लिया है। इसमें सर ने काफी सारे ऑनलाइन कोर्सेज किए हैं, ऑफलाइन कोर्सेज किए हैं। जो हमारे पहले कुछ सेशन हुए हैं इस महीने के फ्री ऑर्थोपेडिक सेशन, इस सब चीजों में हमने देखा है। और यह सब स्ट्रगलिंग फेज आप सबका ना हो, एक सक्सेसफुल आयुर्वेद ऑर्थोपेडिक प्रैक्टिशनर आप सब लोग हो, इस उद्देश्य से हमने यह कोर्स स्टार्ट किया है। आज का पहला जो इंट्रोडक्टरी लेक्चर है जूम पर लेने का भी हमारा ये उद्देश्य था कि एक 6 महीने की जर्नी के लिए हम साथ में नहीं है, तो यहाँ से आगे आने वाले समय में हमें सबको साथ में रह के एक बड़ी अचीवमेंट करना है, एक बड़ा आयुर्वेद ऑर्थोपेडिक प्रैक्टिस करने वाला ग्रुप बनाना है, सबको एक सक्सेसफुली ऑर्थोपेडिक प्रैक्टिस स्टार्ट करना है। हम देखते हैं कि बहुत से बार पेन मैनेजमेंट में सभी पेशेंट हमारे पास घूम फिर के आते हैं और उन्हें एक अच्छा रिजल्ट हम दे पाए। एक स्पेशलिटी प्रैक्टिशनर से यही एक्सपेक्टेशन रहता है कि लास्ट की जर्नी पेशेंट की वहां रुकना चाहिए और वो हंसता खेलता हुआ जाना चाहिए। तो यह सब चीजें एक उद्देश्य से आज हम इस कोर्स को स्टार्ट करते हैं। कुछ इंस्ट्रक्शन मैं आपको देना चाहूंगा। आईआईएस ऐप की लिंक मैंने ग्रुप में डाली है। अगर ये एंड्रॉइड ऐप की लिंक है, कोई एप्पल मोबाइल अगर यूज करता होगा तो प्लीज पर्सनली मुझे मैसेज डालिए, उसकी लिंक सेपरेट से हम डालेंगे। कल के लेक्चर हमारे ऐप पर शुरू होंगे। लेक्चर होने के 72 आवर्स के अंदर हम लोग रिकॉर्डिंग अपलोड करते हैं या रिकॉर्डिंग ऑटोमेटिकली अपलोड हो जाती है। रिकॉर्डिंग किस टाइप से देखना है यह भी इसका एक डेमो वीडियो आपको वहां डाला गया है। सिंपल चीज है, आपको आईआईएस ऐप डाउनलोड करना है, एज अ स्टूडेंट्स लॉगिन करना है। आपका व्हाट्सएप ग्रुप में जो नंबर है उसी नंबर से आपको लॉगिन करना है। बैचेस में जाना है, आयुर्वेद मास्टर क्लास इन आयुर्वेद ऑर्थोपेडिक बैच को सिलेक्ट करना है। और जब हम लाइव जाते हैं तो वहां पर ज्वाइन नाउ का ऑप्शन आता है और रिकॉर्डिंग के लिए लाइव क्लासेस में अवेलेबल रहेगा। तो एक हेल्दी इन्वायरमेंट से हमें आगे जाना है। टेक्निकल दिक्कतें, छोटी बड़े प्रॉब्लम, इसको निग्लेक्ट करते हुए हमें आगे जाना है। बहुत से बार मैं सर के साथ जब सर के ओपीडी में देखता हूँ या कभी मैं सर के क्लिनिक में रहता हूँ और उनके ओपीडी में जब मैं देखता हूँ तो सर एक परसेप्शन करते हैं कि पेन, कल अगर पेशेंट आया होगा और आज वो इस लैंग्वेज में बोलता होगा कि कल से ठीक है, तो एक पॉजिटिव अप्रोच हुआ। उसी टाइप से हमें एक पॉजिटिव अप्रोच लेके आगे जाना है और इस जर्नी की हमें आज से शुरुआत करना है। एक हेल्दी इन्वायरमेंट में आप सब लोग एक अच्छे आयुर्वेद ऑर्थोपेडिक प्रैक्टिशनर रहेंगे, एक सक्सेसफुल प्रैक्टिशनर रहेंगे, इसी आशा से हम लोग कोर्स स्टार्ट करते हैं। सर प्लीज आप कंटिन्यू कीजिए।
Dr. Manjusha madam want to say something. Madam, you can unmute yourself and speak.
Yes, sir. Good evening, everyone, and good evening, all the participants. I welcome all the participants with the orthopedics, and we are going to stay together not just for 6 months, but for many years to go. Because in future, as Dr. Lalit Kheda sir had said, that we have a vision to create a community of Ayurveda orthopedic practitioners, so that we can refer our patients to each other and we can support each other. Right, sir? So in this WhatsApp group, we have a main WhatsApp group, right? That is main masters in Ayurveda orthopedics. In this WhatsApp group, we have our faculty member, that is Dr. Swapnil Gavande sir, also in this group. So I request all the participants that whenever we go through lecture by lecture, the participants are requested to ask the question related to that subject only. Like for example, today if we are doing anatomy or the physiology, functional anatomy and physiology, so please restrict yourself to ask the questions related to that topic only. Please don't jump directly to the treatments. Of course, we are going to take the treatments, but I know all the Vaidyas are very enthusiastic, they are very passionate. So we'll go step by step instead of jumping directly to the treatments. We need to understand first the basic things. And also I request everyone not to, we won't permit anyone to forward the forwarded messages or the good morning, good night messages. So we'll keep the group clean only for the studies. Also, this group is for the question answers and no other chats is allowed over here. If you have any matter other than the questions and discussions on the subject, you may inform to the admins in the personal messages. Like if you have any query like how to watch the video or etc. Some glitches are there. So just message in personal so that the group is clean only for the studies. You don't have to scroll it through the messages and find the right message. And the policies and the regulations of this group will be looked only by me and Dr. Lalit Heda sir. We are the admins, and of course Dr. Gavande sir. If unwanted messages are posted, please unmute yourself. I know who is there. Dr. Swapnil sir, if you can see someone mute.
Yeah.
I think, yeah, please unmute him. Dr. Kamini ma'am, you can also mute yourself.
Yeah, you can continue.
Yes, sir. Yes, sir. Apart from this, if unwanted messages are posted in the group, we will also think of removing the participant from the group so that they can correct themselves. Don't take it personally. This is only for your sake. Also, make sure always that you don't share the meeting IDs and the passwords and the links of the group to the other participants who are not the part of this course. We will be opening the meeting sharp like 10 minutes prior to the timings which we have announced. Today we will be also discussing about the timings, whether we have to continue with 9 p.m. or in the afternoon sessions. So we'll take a poll in the group and accordingly we'll decide which timing is suitable for everyone. Also make sure that you reach or you log in on time so that you don't miss out the initial part of the classes, because we usually see that people don't join on time and then at the end they ask doubts related to that topic, which creates a waste of time for the other doctors who have joined on time. So please make sure to join on time. Please also make sure that this online platform is IIAS app, and this app or the software which you download from Play Store or Apple Store, you keep this app updated. There might you might receive some updates, so keep on updating the app so that you can avoid the technical issues. Apart from this, please make sure that whenever you chat in this group, you have a positive mindset while asking the questions. No hate speech or no bullying or no pulling the legs of our participants. Everyone should feel safe over here, okay? So degrading comments will not be tolerated. Be kind and courteous. We all are here to create a welcoming environment and a positive with respect, because might be in this group there are just students or the newcomers, and few might be the practitioners, already practicing doctors. So some doubts which you may feel silly, it can be a new like perspective or the new topic for those new doctors, the fresher doctors. So we should treat everyone with respect. Healthy debates are natural, but kindness is required in those debates. After the class, each class, The recording will be available on this IIAS app itself for further access. In next 2 to 3 days, we'll try to upload as soon as possible. But sometimes, like you can see, it's rainy season nowadays, and sometimes the file size is also large. So uploads of the recordings can be delayed. But we'll always try to upload it as soon as possible. We always try our best from our part also, and from like admin speakers, maximum inconvenience to the students and the participants. But after all, we are also human beings, and sir may have some changes in the dates or timing. So kindly schedule. But yes, of course, we'll inform in the WhatsApp group prior if there is any change. Give more than you can take in this group. Self-promotion, spam, or irrelevant links are not allowed in this group. Being the part of this group requires mutual trust. Authentic, expressive discussion makes the group great. But also, we will request you to keep all the chats and the discussions in this group to be private. Okay. Yes, sir. For today, this much is okay.
Thank you
Lots
very
of
much.
rules and lots
No.
of guidelines to the participants.
Yeah,
Let's
thank you.
create a positive space for learning and to grow together, right, sir? But these are few
Definitely, ma'am.
necessary
Yeah,
guidelines.
definitely it's necessary. The discipline is the most important thing.
Yes, sir.
The
Yes, sir.
discipline will only bring you the best out of you.
Yes, sir.
But ma'am, from all the participants, all the beautiful people in the group, I will assure you that nothing unwanted things will happen in this group. I assure you on behalf of all the participants. So
Right,
friends,
sir.
definitely, जैसे कि मंजू मैडम ने कहा, जैसे कि ललित सर ने कहा, ये कोई सफर 6 महीने का या इन 70-80 लेक्चर्स का नहीं है. हमें जुड़ना है. देखिए क्या होता है कि अभी हमने वर्ल्ड कप जीता, तो वर्ल्ड कप सिर्फ उन 11 प्लेयर्स ने नहीं खेला है, वर्ल्ड कप उस सपोर्टिंग स्टाफ ने नहीं खेला है, जीता है, बल्कि पूरी इंडिया ने जीता है. वी प्राउडली से दैट वी हैव वॉन द वर्ल्ड कप.
आदिती गोवी कोणत्या ती सुद्धा माहिती जर झाली तिचं नाव.
I would request that I know that it's only 9:20 and some of you may be in your OPDs, but be vigilant, be conscious that your mic should be mute while you are doing the multitasking. I would request you all that please don't do multitasking while and during the lecture, but if there are some unavoidable circumstances where you have to do something, so be vigilant that your videos should be off and your mic should be mute so that others will not get distracted. So friends, the today's session is just for the introduction, just for the one-on-one conversation. Today, as I have said, this is an onboarding session. All that about IAS, Dr. Lalit Heda sir said, मंजू मैडम ने इतनी सारी लंबी लिस्ट दी है जो कि बहुत जरूरी है हमारे लर्निंग के लिए, क्योंकि आप लोगों ने, आप सभी लोग या तो प्रैक्टिशनर हो या तो इंटर्न हो, और हम सारे लोग जो डॉक्टर्स हैं, वैद्य हैं, हमें सीरियसली हम लोगों ने, आप लोगों ने इसमें टाइम आप इन्वेस्ट करने जा रहे हो, आपने ऑलरेडी मनी इसमें इन्वेस्ट किया है, क्योंकि आप सभी लोग कुछ ना कुछ सीखना चाहते हो, आप कुछ ना कुछ गेन करना चाहते हो, आप अपनी लाइफ में ग्रो करना चाहते हो. तकरीबन यू वोंट बिलीव, तकरीबन पूरे इंडिया में ये मैसेज सर्कुलेट हुआ, इस वर्कशॉप के बारे में बात हुई, बहुत सारे लोगों ने मोर देन 500, 300, 500, 600 calls we received regarding the this inquiry कि सर क्लास कैसे होने वाला है, कोर्स. लेकिन you people are the action takers. आपने एक्शन ली है, और आपने एक्शन ली है खुद के ग्रोथ के लिए, आपने एक्शन ली है खुद के डेवलपमेंट के लिए, क्योंकि आप लोग चाहते हो कि आप जहां पर हो वहां से आगे बढ़ो, आप जहां पर हो वहां से बेटर बनो. So I always tell always the favorite sentence in my life is be better. Be better every minute, be better every hour, be better every day, be better every year, and better every decade. And we will one day will be legend. So we all here are to be better. Yes, definitely in this course of 6 months, I am also going to learn lots of things from you. As Manju ma'am already given you lots of instruction. The only one request, I am not going to give you the instructions because I know that there are lots of people who are more senior than me. There are lots of people who are far junior than me. But I request you all that if you have any query regarding which is not regarding to the current topic, you can ask me or message me directly on my, if it is urgent only, provided it is urgent or you are having any difficulty in your OPD with your ongoing patient, you can definitely connect with me on my WhatsApp on call as per my convenience, as per I got the time. I will definitely going to answer your query, but don't put it into the group because if you will start one discussion in the group, lots of people will jump into it and it will create a mess there. The other thing is that if you have some interesting case, if you have some interesting presentation with you, you can definitely put into the group that will elaborate, that will enlighten others' knowledge also. But please don't put that the cases like that. Look, this is the frozen shoulder patient before and this is after, because I am the person who don't believe in the result. I hate the word results because they are not in our hand. Results are not in our hand. The only thing which is in our hand is to diagnose at par excellence, at par pinpoint, and to follow the process as per our understanding. We can just follow the process. And if we follow the correct process, the right process, definitely the result will be the right, the result will be the great. But don't just think about the result. If you are getting a result and you can't explain the process, that how you got that result, people will call it as a miracle, and miracle never happens again and again, believe me. They can happen once in a blue moon, but if you want the reproducible results, if you want the reproducible result, you have to definitely follow the process. So always be stubborn to follow the process and not just see the results. So I never speak about the results. I always speak about the process. Okay. If a process is wrong, then definitely result is going to be wrong. If the process is correct, then definitely the result is going to be correct. As we all are human beings, we have the limitations, we have the human limitations. Also in Ayurveda, you know that the basic classification of the Vyadhis are like Sukha Sadhya, Ayapya Sadhya, and Asadhya. So if the great legendary sages, the great legendary acharyas had said and categorized this particular disease as Asadhya or incurable, then we just can help the patient with maximum relief from the pain, maximum relief from his uh, illness, but we can't guarantee. So never use the word guarantee. I never use the word guarantee in my practice about anything. Yes, there is only one guarantee. There is only one guarantee regarding this course also, regarding the treatment of patient also. And that guarantee is that I will put 100% of my, I am going to put 100% of my efforts. So I will also appeal to you all that please put 100% of your efforts, and I would be very happy. I will be very happy if most of you will be the legendary pain management specialist Ayurveda doctors in your city, in your community, whatever. We should be very vigilant. We should be very careful when carrying, because we are carrying the flag of our pathy. we are the flag holders. We are the leaders of our fraternity, and we should lead like a leader. So I would all request you that don't do any kind of malpractices. Be honest, be fearless, and be knowledgeable. And I hope that this session is going to be very much interesting, very much knowledge sharing, knowledge gaining. It will be for me, because teaching is always learning. I am also going to learn lots of things from you, lots of things from your experiences. And I would now request all the participants, if they can unmute themselves, they can put their views about this course, they can introduce themselves. I will not insist to everybody, but I will request that maximum people from you, please introduce yourself, so that we can understand each other in a better way. We can understand each other in a great way, and that will make a wonderful environment of this group, as a learners group, as a achievers group. So I will request all the participants, please unmute yourself one by one, and you can introduce yourself and also your aspirations, your expectations from this particular course. I will also ask, if you are comfortable, if it's possible to you, switch on your videos also. So Dr. Ramesh, you are unmute.
Yes.
You
So
can
good evening,
introduce
sir.
yourself. Good evening, very good evening, sir.
I am Dr. Amish from Sri Lanka.
Okay, sir.
I am working as a community medical officer in the Department of Ayurveda, Ministry of Health in Sri Lanka. So I am practicing cupping therapy for 12 years and Marma 6 years. But I have found that you are very capable of integrated system in the Ayurvedic orthopedic treatment, pain management. So I am very happy to learn myofascial release techniques and osteopathic manipulation techniques and dry needling. Those are things, it's new things to me. So I am very happy to learn from you, because I already went to a profile and I found you spend more time in learning new techniques and integrated to the Ayurvedic system. So it is very much it will be helpful for our clinics and our practice to actually we want to improve our learning, our treatment system, our practice day by day. So like as you said, every day we should be better day by day. So I'm very happy to join this class. I need more lectures in English. To use both bilingual is not problem, but I need lectures notes in English, and it's really helpful to me because I can't read Hindi. So it will help me if you give me the notes in the English. Thank you.
Yeah, definitely. It was I'm very glad to have you here on this course, and definitely as I have told earlier also, that this course is going to be a bilingual. For the better understanding, I am also explaining some of the things in the Hindi also, though my mother tongue is not a Hindi nor English, but I am going. There are lots of people who are from Maharashtra state of though this language which is acceptable, that is Hindi and English. Definitely about notes, somebody also asked about the notes. I want to clarify that everything is not going to be into the theoretical notes. As in the earlier introduction course also, I have told that I am not a typical college professor who is going to teach you. I am a hardcore practitioner. And whatever I am sharing with you is out of my practice, out of my learning. No doubt, in Ayurveda, it is said that karmabhyas and granthabhyas both are necessary. So your theory and practical both should be sound to practice in a to practice in a excellence. Hence, I am going to share with you definitely the notes, which notes or the PPT presentations which I am going to share during the classes in the form of PDF. Definitely, it may sometimes immediately after the class. Sometimes it may take 1 or 2 days. as per my convenience. I will, but definitely I am going to share all that which is going to be demonstrated on the lectures. Although if I got some of the good articles, if some of the good reference books, some of the PDFs which can put more knowledge into your practice, that will I am definitely going to share into the group. I am not keeping anything towards me. I am going to give you everything, because I think that we have to run a relay race. You might have gone through a relay race. What happens in the relay race? The baton is transferred to the next person and then next person, and when a team wins. So we all have to win. Just I or not Dr. Ramesh is going to win. We all have to win. And here I am not your lecturer or a teacher. I am just having a upper hand about the practice that I am going to share. Yes, yes, Dr. Pardesi.
Oh my God, I'm so happy. Swapnil Gawande, I am so happy. देखो, I will talk in English and in Hindi also, because since last 12 years, finally I can talk in Hindi. So I'm so happy. मैं पिछले 12 साल से यूरोप में हूँ सर. मेरा जर्मनी में, पोलैंड में मेरा खुद का हॉस्पिटल्स है. मैं पंचकर्मा का और नाड़ी परीक्षण का मैं अच्छे से अभ्यासक हूँ. श्री श्री रविशंकर जी के साथ तो मैंने काम किया है पिछले 12 साल से. So I really have this liberty to talk in Hindi, because I don't want to say anything about the technicality that the first classes happen with us. But I'm very honest with you. I'm running 500 concerts and the online classes over the world. पूरे दुनिया में, अमेरिका में इसमें मैं कर रहा हूँ. But my doctor Ahire, Sushma Ahire from the Nasik, she recommended this class. और जो मैं आपका जो एक passion देख रहा हूँ ना, so I'm so happy. Thank you so much that I am the part of this passion, let's say it's a kind of utkranti, evolution, तो बाकी का तो मैं कुछ बोलूंगा नहीं. But today I am so happy that I am the part of these orthopedic things, and congratulate you from my heart that you are doing the great job. And today I'm just telling you, thank you so much. It is only about the thank you so much for yourself.
Yeah. So obliged, sir. So obliged. Thank you very much for your great words and your great appreciation about this. But the thing is that I always believe that we can grow together. We can grow more. And definitely I am going to pour 100% of my experience into this. This is not only about the money. This is not only about, but this is all about the people. The PPT I am going to share. You will get the the PPT after this introduction session. I am going to share the first ever slide. You will go to find that how we are going to help the people. We will be just like the messenger of the gods. We are going to be the pain hackers. Thank you very much, sir, for attending the course. Actually,
I'm sorry. I'm sorry to.
Yes, sir.
Yeah, I'm sorry. I'm just exceeding my things. I'm your participants, not the host, but because everybody offers, हमें हर अपने डॉक्टर जो लोग हैं, शायद मैं हूँ, जो भी है, but the most important the Ganesh energy, the all teamwork, what we have come together, and so I'm so thank you, and I will be the part of your need to have this participation. So I'm going to keep mum for this. Okay, thank you so much.
Yeah. No. I should thank you all people that you have kept trust on me and give an opportunity to me to share my knowledge with you. Yes. Anybody else? Dr. Prithviraj, I think. Dr. Rohit, I think you have to say something. आप हिंदी में
Very good evening, sir.
Very good evening, sir.
सर मैं इंटर्न हूँ BMS के बाद में, मेरी इंटर्नशिप कंप्लीट होने वाली है और बहुत सारे ऐसे प्रोसीजर्स हैं जो कि हम लोग देखते हैं सामने होते हुए आयुर्वेद में, लेकिन हम लोग ना उसको प्रॉपरली एक्सप्लेन नहीं कर पाते. जैसे हमारे काउंटर पार्ट अगर हमारे सामने कोई और पैथी के बैठे हुए हैं तो हम जो रिजल्ट ले रहे हैं वो हम प्रॉपरली एक्सप्लेन नहीं कर पाते हैं एज पर अवर टेक्स्ट या कुछ, कि भाई हम उसे कैसे कर पा रहे हो, रिप्रोड्यूस कर पाएंगे या नहीं. क्योंकि रिसर्च का कहीं ना कहीं वो लोग कहते हैं कि आपके साथ में लेकुना है, उन सब चीजों में हमें नहीं पढ़ना है. मैं सिर्फ ये चाहता हूँ कि जो भी हम ट्रीटमेंट करें वो रिप्रोड्यूसेबल हो और सेकेंडली मैं एज पर टेक्स्ट ट्रीटमेंट कर पाऊँ और इस फील्ड के अंदर जो भी अभी की लेटेस्ट मोडेलिटीज हैं वो आपकी गाइडेंस में सीख पाऊँ, दैट्स इट। इतना ही मेरी एक्सपेक्टेशन है इस कोर्स से। और जो भी मेरे पास पेशेंट्स आते हैं उनकी जो पेन्स हैं वो अगर मैं कम कर पाऊँ तो दैट वुड बी अ गुड ग्रेट ऑनर फॉर माई सेल्फ फ्रॉम मी।
डेफिनेटली डॉक्टर रोहित, वेरी नाइस वर्ड्स, और बहुत अच्छी बात आपने कही। देखिए, हम इसी बात को जैसे हम एक पैच को छीलते हैं एक बाय एक, तो वैसे एक परत दर परत ये कोर्स खुलता जाएगा। तो जैसे जैसे हम आगे जाएंगे यू विल हैव दैट क्लैरिटी। हाँ, डेफिनेटली, एज आई सेड, आई एम नॉट अ हार्डकोर प्रोफेसर, सो देयर आर सम माय ओन concept that I am going to share with you. There may be the disagreement between some of the participants because they may think in a different way. But definitely, जैसे कि मंजूषा मैडम ने शुरुआत में भी कहा, we will have the healthy debates also. So it is going to be a give and take relation between us. Okay, Dr. Prithviraj.
नमस्ते सर। जय
नमस्ते
जगन्नाथ।
जय।
सर थैंक यू सर कि आई थिंक इंडिया में शायद ये फास्ट कोर्स है जो कि ऑर्थोपेडिक के ऊपर एक स्पेसिफिक कोर्स डिजाइन हुआ है। क्योंकि सर लेट मी इंट्रोड्यूस माई सेल्फ, आई एम डॉक्टर पृथ्वीराज सिंह फ्रॉम उड़ीसा सर। अभी मैं उड़ीसा में प्रैक्टिस कर रहा हूँ सर। पहले से मैंने सर वो अग्निकर्म का न्यूरो पंचकर्म का कोर्स किया है, फिर भी सर वो वर्कशॉप जैसे है। पर ये एक आई थिंक इट्स अ फास्ट कोर्स जो कि एक शेड्यूल में जैसे आएगा कि बहुत कुछ सीखना है। क्योंकि प्रोसीजर्स तो सब लोग सीख लेते हैं पर प्रॉपरली डायग्नोसिस करना और हर चीज में सही वही सेम टेक्निक नहीं लगता है। और इसलिए मैं ऑस्टियोपैथ में एडमिशन लेने जा रहा था और उसी टाइम आपका कोर्स मिला मुझे, तो इसीलिए मैंने उसको छोड़ के अभी इसमें ज्वाइन हुआ हूँ। एंड थैंक यू सर, थैंक्स अ लॉट। और होपफुली आपसे बहुत कुछ सीखने को मिलेगा।
Thank you, thank you.
Thank
I
you.
will try my best. I will try my best to give more
Thank
and
you.
more of you. Yes. Any other participants who want to, who wish to introduce themselves, who wish to express their views?
जी सर
हेलो
Yes, one by one, please, ma'am. Yes, sir.
सर आई एम डॉक्टर रमित। मैं सर असिस्टेंट प्रोफेसर हूँ। मेरी सर एमडी है पंचकर्मा में।
Okay, sir. It's great to teach a teacher. Yes, but I am not going to teach, sir. I am just going to share my knowledge.
जी
Yeah,
जी
you
सर,
can
बस
proceed,
यही
sir.
है। जी 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 सर। सर मेरा भी यही है कि मतलब हम पंचकर्मा से काफी कुछ चीज ठीक कर सकते हैं, पर सर इतनी जल्दी अब वो हमें रिलीफ नहीं मिल पाता। जैसे सर ओस्टोआर्थराइटिस है या मेनली बैक पेन है, तो सर मैं मेनली सीखने के लिए कि वो और जल्दी कैसे हो सके या ज्यादा अच्छा कैसे हो सके, इसलिए सर मेनली कोर्स मुझे आपका ये वाला ज्यादा अच्छा।
Definitely, sir. We will work on that. That how can we integrate the manual therapies with your classical panchakarmas and upakarmas? Definitely, sir.
ठीक है,
Yes.
थैंक यू।
Some of the someone, ma'am was trying to speak. Ma'am, you can.
yes yes
Good
sir,
evening.
I'll just keep my audio on.
Yeah.
Good evening sir, and it's honor to be in the course. My name is Dr. Payal Khandelwal. I'm practicing in Bangalore for last 15 years now, and
Oh, it's great.
I have a complete panchakarma setup. I'm doing agni karma with the karma,
Good.
everything, but of course found good results. But the reason I've joined this course is because I've seen that there is extensive details on diagnosis and also the treatment modalities, which I feel is the need of the hour, because people want to, they look forward to Ayurveda for fixing a lot of orthopedic issues. And like mentioned before, also, a major part of our practice, even if we want or do not want, we see orthopedic cases almost every single day in the
Yeah,
clinic,
definitely.
starting from 20 years now to, sports personalities to all age groups, everybody. So I feel this is good chance to learn, and that's why I've joined the course. Thank you so much.
Yes. Somebody else?
Okay, good evening, sir.
Yes. Yes, sir. Good evening.
Yeah, okay, sir. I'm Vedya Anil Karkar from Surat,
Okay,
Gujarat.
sir. Great, great.
Yeah,
Came
हाँ,
sure.
मजामा। मैंने सर अभी 2023 में मेरा मतलब कि इंटर्नशिप कंप्लीट हुआ। उसके बाद मैं मतलब कि पार्ट टाइम में जॉब वगैरह नाइट में करता था। तो एक ऐसा था कि मतलब कि मैं कैसे अपनी तरह से कोई एक चीज में स्पेशलिटी करना चाहता था, लेकिन मेरे पास पीजी वाला ऑप्शन नहीं करना था, इसलिए तो बाद में कई सारे कोर्स ढूंढ रहा था। लेकिन आपके पास से जो मैंने मतलब कि मॉड्यूल देखा तो उसमें कैसे डायग्नोसिस करवाते हैं और मतलब कि बॉटम टू अर्थ आप एनाटॉमी विथ आयुर्वेद को रिलेशन करके भी सिखाते हैं। और मतलब कि मैंने वो आपके जो सर थे उसके साथ बात की तो उसने ऐसा भी बोला कि आप प्रैक्टिकल के लिए 2 दिन की जगह 7 दिन, 8 दिन, 10 दिन आ सकते हो, वो आपके ऊपर है। तो वो सब सोच के मतलब कि ऐसा लगा कि मैं कुछ नया, और आर्थराइटिस में स्पेशल करके जो सूरत में है तो वहाँ बहुत सारे पेशेंट है जो ऑस्टियोआर्थराइटिस वाले, रूमेटॉइड आर्थराइटिस वाले, वो मिल जाते हैं। तो उधर हम पेन रिलीव वगैरह सब अच्छी तरह।
आप म्यूट हो, आपका गलती से म्यूट हो गया है सर। यस सर, नाउ यू कैन स्पीक। यस
ओके ओके, तो इसलिए सोचा कि मतलब कि कोर्स लो और आपके पास से थोड़ा कुछ जो नॉलेज मिल सके।
यस सर, डेफिनेटली मैं आपकी अपेक्षाओं पे खरा उतरने की पूरी कोशिश करूंगा। थैंक
ओके
यू।
सर।
यस, as any more participants who want to introduce themselves, who want to express their views?
नमस्ते सर।
नमस्ते मैम।
मेरा नाम अनुराधा है और मैं यूरोप में प्रैक्टिस कर रही हूँ,
ओके
ज़्यादातर आयरलैंड में। और मैं थोड़ा इधर ट्रैवल भी करती हूँ काम के हिसाब से। मैं आयुर्वेदा प्रैक्टिस कर रही हूँ और अभी मैं ऑस्टियोपैथिक मेडिसिन एक लंदन से जुड़ा हुआ कॉलेज के हिसाब से मैं कर रही हूँ। और मेरा हमेशा कुछ नया सीखने का मन है। हमेशा मैं अपना कंटिन्यूस प्रोफेशनल डेवलपमेंट में अपना टाइम और एफर्ट्स में इन्वेस्ट करती हूँ। जब आपका मैंने वो ज़ूम मीटिंग देखा था तो मुझे ऐसा लगा कि आप बहुत कुछ जानते हैं और आपका ये एंथुसियाज्म है, आपके जगह जो भी नॉलेज है वो आप शेयर करने के लिए तैयार है, एंथुसियास्टिक है, ऐसा लगा मुझे। और मुझे ऐसा लगा कि अम, साथ साथ पढ़ने में कुछ ज़्यादा भी इंटरैक्टिव स्किल्स डेवलप हो सकता है और हमारा एक ग्रुप भी बन सकता है। तो मैं आयुर्वेदा में लाइफस्टाइल, योगा, मेडिटेशन वो सभी मिक्स करके मेरा प्रैक्टिस करती हूँ और रिजल्ट्स भी अच्छा मिल रहा है। लेकिन फिर भी मुझे और भी इम्प्रूव करना बहुत पसंद है। तो
डेफिनेटली
शायद मुझे यहाँ और कुछ मिलने को मिलेगा।
डेफिनेटली मैम, वी विल आल्सो गेट टू लर्न यू फ्रॉम लॉट्स ऑफ थिंग्स। कैसा है ना मैम कि आप जो कर रहे हैं तो दिस इज द थर्ड मोस्ट, अगर आप मॉर्बिडिटी का देखोगे तो नियर अबाउट more than 50% of the population is struggling with the musculoskeletal disorders. So you are definitely
Yes,
going to get help from this course also, and also we hope lots of learning from you also. Thank you very much, ma'am. It was very nice to hear from you.
thank you so much. Thank
Yeah.
you.
Yeah. Anybody else?
Good
Okay.
evening, sir.
Good evening, Dr. Shiva.
Sir, sir, I'm Shivam. सर मेरा फाइनल ईयर एंड होने वाला है, इंटर्नशिप स्टार्ट होने वाला है,
Okay.
एंड सो आई वांट टू लर्न एंड एक्सप्लोर एवरी एस्पेक्ट ऑफ आयुर्वेदा। सो जब मैं प्रैक्टिस स्टार्ट करूं तो मुझे पता हो कि मैं क्या प्रोसेस कर रहा हूँ और क्यों कर रहा हूँ।
डेफिनेटली दैट्स व्हाट आई फॉलो। कि
जी सर।
मेरे जो सर थे वो यही कहते थे, अगर आप पेशेंट के बॉडी पे कहीं पे भी टच कर रहे हो, वेन एवर और वेर एवर यू आर टचिंग द body part of a patient, you should know that why you are touching at that particular place and what is behind it, what is beneath your hand, what is the structure, and what was your motto of touching at that particular part. So your vision is very great.
जी सर, थैंक यू सर।
Yes, anybody else, or else we will start the today's presentation. The today's presentation is not about anything learning. I'm just going to share with you something and about the course, that how it is going to happen. So as you all know, we are already entered into the masterclass in Ayurveda orthopedics. So first of all, when we call the Ayurvedic orthopedics, lots of people get confused about that. That are we going to deal with the orthopedic cases like fractures and the hip replacement or other things? But you have to understand that first, broad spectrumly, orthopedics is divided into two streams or the two parts. The one part is called as the hot orthopedics and the another is the cold orthopedics. So definitely we are going to deal in the Ayurveda orthopedics because we have to respect the usefulness, the significance of other pathogens also. It is not like that if you are practicing in the Ayurveda orthopedics, you are going to overcome or going to cross over the orthopedic surgeon's work. Because the orthopedic surgeon's work is primarily to deal with the hot cases like fracture, the ligament tears, the other disintegrated disintegrated anatomical structures. So basically what surgeons do, surgeons integrate the disintegrated parts. So in Ayurveda is the first science in the world who suggests the branch of medicine as a surgery. Sushruta was the first surgeon of the Sushruta was the first surgeon in the world, and he himself tells that there are the Vedis which are Shastra Sadhya. Okay, जो हमने दिखा दिया एक औषध साध्य एंड देन द शस्त्र साध्य. तो शस्त्र साध्य व्याधि दुनिया को बताने वाला ही अगर आयुर्वेद है तो वी कैनॉट डिनाई द इम्पोर्टेंस ऑफ सर्जरी, वी कैनॉट डिनाई द सिग्निफिकेंस ऑफ सर्जरी. तो प्लीज ये मत किसी को कहना कि सर्जरी बुरी होती है या सर्जरी करने से कोई नुकसान होता है. बिकॉज इफ यू आर सेइंग दैट, इफ यू आर टेलिंग दैट, यू आर ऑलरेडी, आप अपने ही शास्त्र का अपमान कर रहे हैं. यू आर इंसल्टिंग योर साइंस, यू आर इंसल्टिंग योर संहिताकार, because every संहिताकार had accepted surgery as a branch of medical health. Okay, so first of all, this is very clear that there are some of the cases which we can manage of the hot orthopedics, like the partial tear, the large grade tears of the ligaments and tendons, and some undisplaced fractures. We can nicely manage them with this help, and we are going to share about all that things. But when there is a need of obvious surgery, you should be broad-minded, you should be enough broad-minded that you should refer that particular patient to your orthopedic surgeon. And definitely when you gain or when you understand and when you explain that orthopedic surgeon that what you can do or how you can help the patient with the cold orthopedic, that physician or that orthopedic surgeon is also going to refer patient to you. I got the reference from the orthopedic surgeons in my city. I got the 7 orthopedic surgeons as my patients also in my clinic. Because if we make our mind broad spectrumly, or if we are able, if we are knowledgeable enough that we can explain that what we are exactly doing in their language. देखिए अभी थोड़ी देर पहले डॉक्टर रमीश सर ने बोला था, डॉक्टर रमीश had said that I want the lectures into English because it is difficult for me to understand the Hindi. So if I want to share my knowledge with him, I want that my words, my knowledge should reach to him. I should explain him in the language which he understands. So this is what our language, there may be a language barrier about the Ayurveda language and the modern science language. But in this course, I am going to try my best to integrate both the language. It is same like in India we speak English, which is a integration of Hindi and English. Like that, we are going to create this integrated system of pain management. Okay, so just quickly see the prevalence of the cold orthopedics. I am not speaking about the hot orthopedics. I am just speaking about the cold orthopedics. So 3.1% total population have the neck pain. The 6.63% patient have the thoracic pain. The 42.22% have the knee pain. I am speaking all about the musculoskeletal disorders. musculoskeletal issues. If you take the 100% of cases of musculoskeletal, then the 3%, 3.61% of neck pain, knee pain are the 42.22%, lower limb pains 27.12%, non-specific pains, which can be categorized as idiopathic in modern science, but in Ayurveda we have got the different classification, that karmas, kulas, atmas, and also the what we call as the Amas Samprapti. The lumbar pain have the prevalence of 19.28%, the arm pain or the hand pain around 4.76%, upper limb, the upper limb, that is the part from deltoid to elbow joint, consists of 27.12%. The complete upper arm is consisting the 14.29%, and the shoulder is also plays a major role in the pain, that is 77.27%. So no location specified are the 17.47. In Ayurveda, the beautiful phrase is used for that, that is Sanchari Vedna. Multi-site pain have the prevalence of 13.25%, and this data is after COVID. This data it's collected after the COVID. So 50%, that is 166 out of 331 of individual discharged from the hospital following admissions of COVID-19 reported the musculoskeletal pain in at least one area of the body. So this was actually the scenario. Although if you grade that what are the reasons to visit a doctor for the patient, so it is the 5th most common reason to visit the doctor. And as Dr. From Bangalore, Dr. Anu, I think Dr. Payal said that correctly, that every day we see at least 1 or 2 cases of the musculoskeletal pain in our OPD. Please mute yourself if you are not adding something. So this was just the prevalence of the location of the musculoskeletal pain following COVID-19. So the COVID-19 has already donated these pain conditions. Why I call donation? Because it was not only because of the drugs, not only because of the drugs, not only because of that disease, but also the psychological impact of the COVID has also a significant role in increasing cases of the musculoskeletal disorders. The avian, once we call that only 1 in 1 lakh patient got the avascular necrosis of the hip joint, but I think that most of you have seen these cases in your OPD, in your practice after COVID. Post-COVID, the prevalence of the diseases like avascular necrosis, the seronegative rheumatoid arthritis, the post-viral arthralgia has increased in a large number. So that's why we are going to help people in lot more way, and we are going to cover all these part in our upcoming course. And as most of you have gone through the introductory lecture, so I will keep it short, that all these things we are going to learn one by one. In the first module, we are going to learn about the anatomy, functional anatomy, about the spine and the joints. Then we are going to discuss about the diagnosis, how clinical, radiological and pathological diagnosis we have to do, what are the radiological. I am not going to, please don't expect that also from me, I am not going to teach you the complete radiology, because you know that there is already a post graduation after 3 years, but definitely I am going to share with you the basic radiological concept so that you can understand the basic radiology. You can better understand the terminologies into the radiological reports, so that you can come to a conclusion for diagnosis. Then definitely we are going to see the bandha, the bandaging techniques, the therapeutic techniques. Some of you may have practicing it, some of you may have heard about it, but definitely you are going to see it with a new vision. Agni Karma and Vedan Karma also we are going to elaborate, as most of the people have said now that they are practicing Vedan Karma and Agni Karma, but how should it use, when to use, when not to use, when it is going to give the result, or when it is not going to give result, or when it is not going to produce the result. What is the difference between Vedan Karma and the dry needling? Because dry needling is also we are seeing, which I personally called it as the Gambhir Vedan Karma. The cupping, the all forms of cupping, dry, wet, dynamic, and fire cupping. Also, some of the demonstration I will give of the fire cupping. Innovative Panchakarma, already we are doing the Panchakarma, but what innovation can we do? I am going to share my personal experience with you. The posture correction, that is the one of the major number one reason for the musculoskeletal diseases or the musculoskeletal disorders is the posture, the postural deformities, the postural misintegrations. And we are going to see the evaluation of the posture also and the posture conscious. No doubt myofascial release is the one of the key point of this. Then the Gambhir Vedan, dry needling, as I have said, the trigger point therapy, which can be associated with the Marma Chikitsa, osteopathic articulation of the spine and joints, instrument assisted soft tissue mobilization, that is very trending nowadays all over the world, and muscle energy techniques, so that you can do a proper rehab techniques. Also, we will go share some of the good yoga postures, or the specific yoga posture as per the joints and the rehab protocols, so that how can you do the rehabilitation of the post-surgical patients. So this masterclass in Ayurveda orthopedics, we are going to have, as you all know that I have shared a number of times this particular list of modules. So this was the today's session, that is introduction and onboarding. Today we are going to see about the general anatomy, how, what are the planes, how should we, what is the nomenclature of the particular plane, what are the common nomenclature of the common name nomenclature for the body parts according to the anatomical. Then in the next lecture we are going to see the Sapta Dhatu and Kala concept of the Ayurveda, then functional anatomy. So I think that in this month, in this week, if it is possible, we can cover the general anatomy and Ayurveda anatomy. In the next lecture we are going to in the next week we will try to cover the functional anatomy. In module 2, we are going to learn some of the physiology, that is the physiology related to the modern physiology of the pain, then Ayurveda Vat Vichar, then the classification of the pain, Vatrok, Samanya, Vishesh Chikitsa Siddhanta. We are going to learn about the particular Siddhanta. Definitely, I am going to share some of the medicines, some of the drugs of my choice during specific conditions, but that will we definitely discuss more in depth when after the module 7, when we will go by one section of the body, like cervical, thoracic, lumbar spondylosis. Then in module 3 we are going to learn something about the more about the diagnosis, that is how should we do the clinical diagnosis, how should be the postural analysis, the radiological analysis, and the pathological analysis. These all things we will try to cover in module 3. In module 4 we are going to speak about some specific Panchakarma or classical Panchakarma, modified Panchakarma, regular Agni Karma, Vedan Karma. All these classical things we are going to cover into the module 4. Into the 5, the ancient models with the modern techniques we are going to learn, like cupping, the all forms of cupping, bandhan, kinesiology taping, myofascial release. So these things, the schedule, the module will continue into the 6th module, where we are going to cover up the trigger point, Marma Chikitsa, osteopathic articulation, and the soft tissue mobilization. In the module 5, basically we are going to learn that how the instrument we can use, or which tools we can use to treat the patient. In the module 6, it will be complete manual in which we are going to use our anushastras, that are our fingers and our hands. And from, as I have said earlier, from the 7th module, we will go section by section. In every section, we will discuss about again the diagnosis, the most common diseases about their particular section, about the cervical spine, that what are the major problems or what are the most common diagnoses we can have in the cervical spine, then what is the treatment modalities we are going to use, and then what should be the rehabilitation protocol for that particular section. In that manner, we are going to cover all the body parts, all the joints in our body, all the joints into the musculoskeletal system. In module 10, we are going to discuss about the rheumatism, the different phases of rheumatism, that is what is post-viral, what is, and then what is post-streptococcal, or what is seronegative RA, or what is the RA after the Garavish or the after the intoxication. We are going to see the ankylosis part. We have seen the ankylosing spondylosis, ankylosis of the joints. We are going to cover into module 10. In module 11, we are going to discuss about the special conditions and syndromes. Also into the module 11, we are also going to discuss the cases which you will submit as a part, and in module 12 we are going to speak about the diet and nutrition, yoga, and also one thing left there is the muscle energy technique. So this is how we are going to see after every module, after every specific time period, we will have the question answer and the query sessions. After every specific interval, in that I will give some of the assignments to you also, and also you are going to submit some of the cases which you want to discuss at that platform, but regarding to only that module. Okay, friends. So thank you very much once again. So our dedication will bring our perfection will bring our performance, and our performance will bring our success, and we will be the ultimate champion. We will be the ultimate pain hackers. So thank you very much. So this was all from me. I will be there again for 15 minutes. If some of you want to share their views or have any queries about this particular course, about this particular curriculum. One more thing, definitely there will be also the assessment and the people which are going to participate in the assessment, or everybody, it's compulsory. It will be compulsory for everybody to complete the assignments which I am going to. I am not going to give you the time consuming assignments, but definitely as per to understand what you are understanding from the learning, I have to take the after the particular course. Dr. Patel sir, as I have already clarified earlier also, that there are no specific PDF notes, but definitely whatever I am going to share with you, I am going to share the PDF of the all the presentations with you. और सेकंड थिंग, आप जब ये सारे आज का हमको इंटरएक्टिव सेशंस लेना था, नो डाउट एवरी सेशन इज गोइंग टू बी इंटरएक्टिव. हर सेशन में आप अपना क्वेरी रख सकते हो. डेफिनेटली वी विल प्रिजर्व, बट स्पेशल क्वेरी टाइम or the special session will be taken at most probably in daytime or in at weekends, so that we will decide into the as per poll into the most important thing, that this time suits me better, because in afternoon what happens, if any emergency comes to my clinic or I have to attend some patient, then it becomes difficult me to do the both the things, and it will be an injustice with one or the other. If I will focus on the class, I will make the injustice with the patient, and if I will focus on the patient, it will be injustice with you people. So that's why I will request you that to please bear. If you miss any class, you can go through the video recording into the app, and the videos with the app will remain for a long time with you, so you can again and again see the that particular topic. Yes. You can unmute yourself and ask any query or anything if you want to share. We will end up today's session by 10:15 sharp. When they come in, you want to ask something? Kamini ma'am. Dr. Irshad Khan sir, we are going to start the lecture by 9 p.m. It may be 1 or 1.5 hour. 1.5 hour, it depends on topic. Because I can understand that we can't make so late. If some of the thing left of that particular topic, we will carry forward it on the next day. I will take the extra class if something is left out. So I'm not going to say that if I am committed 3 lectures, I will going to take only 3 lectures Monday, Tuesday, Wednesday. If I think that some of the other lecture got sir, it is not possible for me to take the lecture at 3 p.m. But definitely we will have some of the query session at 3 p.m. because it's my OPD time and sometimes it is very difficult for manage both the things. So I really apologize for that. And definitely, if it's possible, I will try to do it. Yes. Anything else, Fox? You can unmute and directly can speak with me. You can directly ask your question. That's why only I took this today's class on Zoom because it is very well worth. From tomorrow, you will get oriented with the app and it will be also very comfortable for you to attend the courses classes on the app. Any more questions?
Hello, good evening, doctor.
Yeah, good evening, Dog.
Okay, my name is Dr. Ugochukwu from Nigeria.
Yes, sir. Please tell me.
Okay, I have a case at hand as we speak now, a case of a spinal cord injury that has kept the patient on the bed for.
We have just discussed about that we are not going to discuss any cases right now. Whenever that particular topic will be discussed into the class, you can ask at that time, or if you have some emergency to treat the patient, you can directly connect with me on my WhatsApp. I will share you. I will solve your query.
Okay, thank you very much. That would be the best thing to do.
Yeah.
I will connect
My number is already into the group. You can take it from there and you can directly share that case with me. I will try to help you out. Okay?
Okay. All right. Thank you very much. Thank you very much.
Yes. Anybody else have any query or any of the doubt regarding course, or if they want to add something else? कल की क्लास की टाइमिंग सर इट विल बी द 9 p.m. 9 बजे रात को 9 बजे on the IIAS app. Will you teach about the dislocations also? Ramesh sir, definitely we will discuss some of the dislocations, but the degree of the dislocation, and it is very difficult to teach the dislocations online. Definitely I am going to demonstrate you some of the cases of the dislocations, some of the particular concepts about dislocations which will help you in your practice. Sir, for now lecture will be on Monday, Tuesday and Wednesday. Yes, definitely. Night. Yes, sir. Yes, Dr. Payal ma'am. सर जो प्रैक्टिकल पोर्शन है क्या हम वो ऑनलाइन सीख पाएंगे सर? डेफिनेटली रोहित सर, आई एम गोइंग टू शेयर द वीडियोस ऑन द रियल पेशेंट्स. I will try to share more and more practical videos so that you can understand the concept. And definitely we have arranged the 2 days hands-on workshop. So I will request the newcomers who are new to practice, who are very junior in practice, they should try to attend the offline workshop, because most of the seniors, most of the people who are practicing through this class, they will understand easily what I am trying to say, but it will may in some of the cases, might be into 5 to 10% of the cases, you may find difficult because you don't got that much of experience of palpation and that much of cases. So definitely you will understand the concept, definitely you can understand the pros and cons of that particular technique, but in some that's for that purpose only I have kept that offline workshop free of cost, so that I can deliver more and more practical to you. Yes, if there are any questions, if there are any particular, you can put into the chat box, or you can unmute yourself and ask. Else we will stop for the day.
If anyone wants to ask any query, please ask.
Also, you can, if you have any query or if you have any doubt related to the things, you can put into the group, but don't mess it with as madam said, that if you have query into any particular technical glitch or any technical. Dr. Chakole sir, Ganesh sir. Dr. Anu ma'am, you want to say something? Okay, if there are no questions, what would be the topic for tomorrow? Yeah, it's already mentioned. The topic for tomorrow is anatomy, general anatomy. You can unmute ma'am yourself.
As always, the first topic is anatomy, but the anatomy which we are learning is completely clinical and applied anatomy, right, sir?
Definitely. Tomorrow the topic for anatomy is like, we are going to see the basic anatomy. In the next lecture, we are going to see the functional anatomy. In tomorrow's anatomical structure, we are going to see that how the gross anatomy that will make you easy to understand the functional anatomy. For example, जैसे हम ABCD में पहले ABCD सीखते हैं, फिर उसके वर्ड्स बनाना सीखते हैं, फिर सेंटेंस बनाना सीखते हैं. So in that way we are going to see some of the most common, because most of the people are practitioners. So the what anatomy we have learned into first year is now skip out of our mind. So we will go to the first basic anatomy, and then we will go to the functional anatomy. And also in the next lecture, we are going to collaborate the Ayurveda point of anatomy with the modern point of view anatomy. Yes. So I think that no more questions, no more queries. Good night. Have sweet dreams. See you tomorrow.